Hello, I'm Dr. Haque. I'm an endocrinologist and the medical director of Starwood Pharmacy program. At Starwood Pharmacy, we believe that if you as a patient understand your condition and your medications, you will be more engaged in your care and it will ultimately lead to better outcomes. This is a general overview. We will be coming up with a series of videos that would explain individual medicines in more detail with information for you such as the dose of medication, when to take it, the side effects, etc. So stay tuned. If you have friends or family members with type 2 diabetes, you may wonder why it is that sometimes some patients are managed with diet only and others are managed with one medicine, and yet some other patients may need multiple medicines and even insulin therapy. The reason for that is quite simple, and yet it's quite complicated. As Tammy told you earlier, patients with type 2 diabetes are generally insulin resistant, which means the insulin does not work well in their body, and they also have insulin deficiency, which means they do not make enough insulin for their body's needs. And the degree to which these processes occur varies between one patient and another, and it tends to change over time. So diabetes being a progressive disease in most patients, the production of insulin goes down and therefore diabetes may get worse with time. So what works initially in some patients may not work over time, and what works in one individual may not work in another one. What are the ways in which diabetes medicines work? And because the fundamental defect is insulin resistance and insulin deficiency, most medications would work either by increasing the amount of insulin that the pancreas make to compensate for insulin resistance, or work on pathways that reduces the insulin resistance, so whatever you make works more effectively. Two other mechanisms that are used by medications include one that reduces the amount of glucose that is absorbed from your stomach and therefore allows the body to control blood sugar with the limited amount of insulin that they have. And the other mechanism is by increasing the amount of glucose you excrete. With that in mind, let's start looking at individual medicines. So the first one is a medicine that is considered the first line therapy for patients with type 2 diabetes after diet and exercise. And this medicine is called Metformin. It belongs to a group of medicine called biquinides. And Metformin works primarily on the liver. So what does the liver do normally? Normally the liver stores glucose, and when we eat, the glucose enters into the liver, and when we have not eaten for a prolonged period of time, the glucose is released from the liver for our body's needs. Well, patients who are insulin resistant or insulin deficient, they continue to release glucose from the liver when they're eating, and the amount that is released when they're not eating is exaggerated. So liver is a very important organ in patients with type 2 diabetes. Metformin makes the liver more sensitive to the insulin, and therefore the defect in type 2 diabetes is improved upon when metformin is taken. The predominant effect of metformin is on fasting glucose because of this mechanism, the morning glucose, the first glucose in the morning. It also improves insulin sensitivity and reduces appetite, so it could be useful for weight loss. A group of medicine that works to reduce insulin resistance is a group called TZD, and the main medicine available in this class is called Actos or pioglitazone. Pioglitazone works by improving insulin sensitivity in the muscles, and because of that, its major impact is on glucose readings after meals. It is used less often now because of some side effects such as weight gain and fluid retention, but if it's used correctly and monitored carefully, it can be quite useful, because if you reduce the insulin resistance, you are actually helping the pancreas, which is under pressure, to make more insulin. And in some studies, when you take Actos early on, you can slow down the progression of diabetes. The next group of medicines are sulfonylureas, and sulfonylureas work by stimulating release of insulin from your pancreas. So normally when we eat food and the starches are broken down, glucose travels to the bloodstream. Glucose stimulates release of insulin from the pancreas, and insulin then allows our body to use glucose. The sulfonylureas act on a receptor on the beta cells in the pancreas, the cells that make insulin, and release insulin from these cells into the bloodstream. The problem with sulfonylureas is that, number one, it causes weight gain because the insulin promotes storage of fat. The second problem is because the glucose release is independent of the glucose levels in the blood. In some cases it can cause low blood sugar or hypoglycemia, but nevertheless these agents are used quite extensively and have been used for the last 30-40 years. The example in this group are agents like glipizide, glyburide or glimepiride. The next group of medicines also stimulate insulin from the pancreas. They are called meglitinides, and the two agents that are included in this group include repaglinide and netiglinide, Prandin or Starlix. So these medications are short-acting compared to the sulfonylureas, and because of the short-acting properties, they are less likely to cause hypoglycemia, low blood sugars, and are less likely to cause weight gain. But because of that short action, they have to be taken before each meal, so sometimes compliance could be a problem. That brings to the next two groups of medication. They work through a mechanism called the incretin pathway. What is an incretin pathway? Well, incretin are hormones that are made by the intestines. When we eat food, ingest food, a signal goes out from the intestine in the form of two hormones called GLp1, glucagon-like peptide 1, and the other one is called GIP. And these are incretin hormones. What the incretin hormones do is they direct the pancreas, the beta cells in the pancreas, to make insulin, and they reduce the production of glucagon from alpha cells in the pancreas. And glucagon is basically anti-insulin, so the net result of this is the insulin production from the pancreas go up and glucagon production from the pancreas go down. The incretin hormones are important for glucose and weight control. The problem with our native GLP1 and GIP is once it's released in the circulation, it is inactivated quite quickly by an enzyme system called DPP4, and that limits its action in a normal person. In patients who have diabetes, the incretin effect is reduced. And the next group of medicine, which is called DPP4 inhibitor, these medicines, they work by reducing the activity of DPP4 enzyme. So the DPP4 enzyme inactivates the GLP1, and because you are inhibiting that enzyme, your GLP1 will last longer, and that helps control your blood glucose. Example in this group include Januvia, Onglyza, Tradjenta. These medicines, they are either available as standalone medications or they are available in combination with Metformin or glucophage. The other way to improve GLP-1's action is to make compounds that are like GLP-1 but they are not removed from the body as fast. And so the next set of medications are called GLp1 analogs. These are injectable medicines. These are not insulin, but they work through the GLP-1 pathway. They tend to be more potent than their cousins, DPP4 agents, because the GLP-1 activity is higher when you use these agents. So they control glucose secretion from the pancreas, they control weight, and they control appetite better than the DPP4 agents. The common medicines in this class include Trulicity, Bydureon or B-Size, Ozempic, and Victoza. Because of their action on the stomach, they can cause nausea or vomiting as well. The newest kid on the block for diabetes are the SGLt2 inhibitors. So SGLt2 is an enzyme in the kidneys that help recover filtered glucose back into the body. And by inhibiting this enzyme, these medicines, they help excrete this glucose and thereby lower glucose levels in the blood. Because you are losing calories as glucose in the urine, these agents can cause weight loss. They also reduce your blood pressure, and more importantly, they have beneficial effect on cardiovascular events and congestive heart failure, and they may have kidney protection as well. Because the glucose is being excreted in an increased amount, these agents can cause urinary tract infections or yeast infection. These medicines include Invokana, Jardiance, Farxiga, Siglatro, or combination of these medications with Metformin. This next group, which are called alpha-glucosidase inhibitors, work by inhibiting the enzyme that breaks down the starches into single units of glucose in the intestines and thereby reduce the absorption of glucose. The problem with these medicines is a significant number of patients get stomach upset, so they're not very commonly used. But they have useful properties such as not causing weight gain, not causing low blood sugars, generally not having systemic side effects. There are a few other medicines that are used for diabetes less often. One of them is Cycloset, which is a medicine that works through dopamine pathway in the brain. They're given early in the morning. They don't cause weight gain. They don't cause low blood sugars. The next group of medicines are actually a cholesterol-lowering medicine called Welchol or Quilicelibin. And essentially, they reduce glucose readings after meals. And of course, insulin. Insulin is needed in some patients with diabetes type 2. Usually these are patients who have had type 2 diabetes for a while and their insulin production from the pancreas has gone down below a threshold. And of course, bariatric surgery for weight loss, can have a profound effect on diabetes. Many of the patients with diabetes, they find that their glucose normalizes after surgery, and if they can keep the weight off, they may not need to take medication for diabetes again. So this was an overview of how different medicines for type 2 diabetes work. I hope you found this information useful. We will follow this with a series of shorter, more focused videos on individual medicines with detailed information that would be useful to you.
Thank you for joining us today and watching our videos. And if you have any questions, please give us a call at 214-618-0052 at Starwood Pharmacy, or you can go online at starwoodpharmacy.com. Thank you. Have a great day.